The coastal city of Mombasa now bears 27% of Kenya's total COVID-19 burden, even though Nairobi County has maintained the lead with 242 cases, which is 63% of all reported cases in Kenya. Mombasa's trend of infections is worrying. Among the 10 new COVID-19 cases recorded in the last 24 hours Wednesday, 9 are from Mombasa County, while 1 is from Nairobi.
In the last 24 hours, we have tested a total of 508 samples from 14 counties. Out of this number, 10 tested positive for coronavirus, and of these, 9 are from Mombasa and 1 from Nairobi. This brings to total 384 total number of positive cases in the country. From the number tested, 284 samples were from Nairobi, while 89 were from Mombasa.
Health Chief Administrative Secretary Dr. Mercy Mwangangi, who tasked Mombasa residents to take measures outlined by the Ministry of Health, seriously noted that the increasing numbers from the two counties was a pointer of immense work required.
All the 9 cases in Mombasa were picked from the community by our disease surveillance teams. Each of the following areas has had 1 case: Old Town, Santana, Miritini, Bamburi, Mikandani, Kibokoni, Ganjoni, Memon, and Chuda. The Nairobi case is from Kawangware.
Nairobi now has 242 cases, Mombasa 106, Kilifi has 9 cases, Mandera 8, Kajiado 3, Kitui, Kwale, Nakuru, and Siaya 2 cases each, with Homa Bay, Kakamega, and Uasin Gishu counties having a case each. Dr. Mwangangi added that 5 more patients have been discharged, bringing the total number of recoveries to 129. The cases were recorded from 508 samples tested in the last 24 hours from 14 counties. At the same time, the CS noted that mass testing may not be achieved at the moment, outlining the ministry's test prioritization strategy.
What we will be deploying shortly is what we are calling seroprevalence studies within the environment. So taking an area like Kawangware and asking ourselves, the population in Kawangware, have they come into contact with any coronavirus case? And if they have, are there antibodies showing that? We need to utilize our community health volunteers to ensure that they run for us what we are calling community-based surveillance, and ensure that they're utilizing a tool that can pick out Purity from the crowd and say, Purity has a temperature, she has these symptoms, perhaps we need to focus on Purity and test Purity.
Since the first case of COVID-19 was reported in the country on 13th of March this year, Kenya has 241 active cases of COVID-19 after 14 succumbed to the disease and 129 recovered. The government says it's embarking on a mass testing exercise soon. For now, Kenyans are being urged to adhere to guidelines provided by the Ministry of Health to prevent spread of COVID-19. Purity Museo, Channel 1 News, Nairobi.